Today, topic of our lecture is, which you can see on the screen, secondary prophylaxis in outpatient practice. I will inform you about relevance of this form of preventive work in outpatient practice. Definition, of course, will specify main purposes of dynamic observation as most important form of secondary prophylaxis for patients with chronic diseases, main tasks, and separate main tasks of secondary prophylaxis and a separate form. Shortly, I will inform you about patient as effective form of secondary prevention. Conclusion. What about relevance of the topic? Majority of chronic diseases in different age groups are widespread in population of all countries of the world, such as especially cardiovascular diseases, oncological diseases, diseases of respiratory system. And these diseases requires systematic, comprehensive monitoring of their stream course in order to increase. And this comprehensive monitoring should be directed on increased duration or prolongate life expectancy and maintain the patient's life quality and prevent development of disability. Definition of prophylaxis as separate form of preventive work. Second, the prophylaxis complex of medical, social, sanitary, psychological, and other measures aimed at mainly early detection, prevention of chronic disease exacerbations and complications, prevention of patients' disability. We will discuss this topic. It will separate lecture about disability, about peculiarities of patients' examination for detection for assessment of their work ability. All these diseases, which we should prevent by secondary preventive measures, causing two disorders of patients' adaptation in the community and reducing their ability to work. What has been secondary prophylaxis by other words? Other definition of this term may be more convenient for memorizing. A system of measures, system not complex, aimed at preventing the progression of existing diseases, early detection of preclinical signs of disease on stage of pre-disease, on so-called pre-disease stage. Early detection of indicators of genetic predisposition of any people, predisposition to cardiovascular, oncological, and other non-infectious diseases, as well as timely therapeutic interventions for prevention the disease complications. For example, secondary prophylaxis of coronary artery disease should be oriented on timely prevention myocardial infarction by effective hypolipidemic diet, by constant intake in hypolipidemic medications, statins, and by adequate lifestyle, healthy lifestyle, avoiding harmful habits, and enough physical activity. As example, I have explained for you now what does mean prevention disease complication. Secondary prevention measures are capable of detecting the disease in its early stage. So, for example, an early stage, then they are asymptomatic and early treatment can stop their development. For example, early detection of ischemic heart disease is preferable when functional class of stable angina is first. And really it may be asymptomatic and we can detect it and confirm stable angina only by stress ACG or by test with physical exertion. And of course with a registration of electrocardiogram. Or early signs, early symptoms of bronchial asthma. Also we can detect by test with physical exertion or hyperventilation or forced ventilation test and spirography. Spirography analysis, interpretation of spirometric parameters such as force expiratory volume for first second of expiration or bronchodilation test with salbutamol. And after detection, this disease on early stage, then functional disorders are not so expressed. And if we will prescribe early treatment, we can delay this disease progression. Now let's enumerate the main circumstances that determine the effectiveness of secondary prevention. First circumstance is how often the disease in preclinical stage occurs in the population. You should know, 5th year of your education, that hypertension is most widespread non-infectious disease in the world. And in some population, of course, in different populations, this level is different, but moderate average level of hypertension prevalence more than 50% in Russia, for example, asymptomatic. Other position which we should estimate before organization of secondary prevention, we should know, did the length of time between signs of the disease and development of pronounced stage. So which period, duration of this period, so-called latent period. For hypertension, it may be very long. For heart valve defects, heart valve defects may be also so long. For other disease, may be shorter. For coronary artery disease, for example, for cardiac rhythm disorders, especially. Next element for analysis of effectiveness is diagnostics test, which will apply for disease detection. Is this test sensitive and specific for this concrete disease? And is this test also as simple for performing on outpatient level, accessible, safe, and acceptable? And that is one circumstance of effectiveness secondary prevention. Does the clinical medicine of adequate medical facilities to diagnose this disease effective, safe, and affordable therapies? So we should, after detection of serious disease, we should suggest for our patients effective, reliable, and relatively safety methods for correction of the detected problem of their health or diseases. In other cases, otherwise, that will at least useless, or sometimes can cause psychological negative patient's reactions. Let's characterize the role of screening in secondary prevention. Procedure of screening. Screening, it's a typical procedure which we should apply for detection of risk factors and for early diagnostics or diagnostics on early stage, some chronic diseases. The role of screening in this process based on informing the population about the main symptoms of the disease. And if patient will be informed, patients, they can perform procedure of self-diagnostics. And after that, of course, they should come to the doctor for a confirmation of their ideas. As for screening, this method of secondary prevention should include relatively simple surveys, such as simple, available in outpatient level, and non-expensive. For example, ACG, blood glucose test, or fasting glucose tolerance test, spirometry, and other methods. Now let's enumerate main methods of secondary prophylaxis. As a system directed on early detection and prevention of any unfavorable events. This complex or system includes targeted hygiene education of patients, including individual and group counseling. Educating patients and their families the knowledge and skills are related to particular disease or group of diseases, especially skills of self-assessment, self-diagnostics of glucose level for patients for better control of glucose metabolism for diabetic patients, diabetes. Or skills for blood pressure measurement, especially with hypertensive disease. As for medical examinations, to assess the dynamics of health, determine the development of disease, and conduct of health and medical measures. What does mean health measures? Improvement of health by active lifestyle, by using of some procedures of hydrotherapy, swimming, contrast shower, and physical daily morning physical exercises, and other methods. Thermal procedures and other. Also, secondary prophylaxis includes the courses of preventive treatment and health improvement target, so-called nutritional therapy, special diet recommendation, exercise therapy, massage procedures, or other physiotherapeutical procedures, and the spa treatment too. Medical psychological adaptation to the changed situation for patient's health, maybe some complication, development of some complication or progression of disease. Except medical reactions of medical interventions, we should suggest for our patients also some psychological support. Next is a correct perception of an attitude to changing opportunities and needs of the organism. And for example, we can add to the diet more vitamins, more fresh fruits and vegetables in early spring period, such as in March. So now, right now, you can start to take additional tablets, vitamins for stimulation of your immune response or general resistance for infections, and for support of general metabolic reaction in conditions of decreased vitamins in fruits and in fresh fruits and vegetables. As for purposes of dynamic observation for patients with chronic diseases, there are achievement, the target or values of the parameters, recommended levels of physical, laboratory, and instrumental examination parameters. For example, targeted level of arterial blood pressure for some categories of patients may be less than 130 millimeters mercury. For other patients, less than 135 millimeters. Or total cholesterol level. For some categories of patients, less than 5 millimole per liter or 200 milligram per deciliter. But for patients with confirmed ischemic heart disease, it should be less than 4.5 millimole per liter. The next goal, which we have to achieve by organization of secondary prevention, is correction of risk factors to prevent disease progression for all people with COPD, chronic obstructive pulmonary disease. Smoking, it's a very unpleasant factor, risk factor, which supports disease progression, and so we have to cancel it as soon as possible. We have to forbid it. Of course, we should organize prevention exacerbation by timely organization of correct diet, by timely correction of risk factors, and lifestyle. Or in some situation, we can prescribe preventive therapeutical recommendations on taking of some medications for prevention of possible suspected exacerbation. For example, peptic ulcer. Prevention by taking proton pump inhibitors. Also, other goal of secondary prevention, reducing the frequency of hospitalization. Why this task is so important? You can ask me. I can explain, of course. Hospitalization, it's not just more expensive kind of medical care than outpatient therapy, but also it can cause negative psychological reaction for patients due to problems due to development of appearance of some problems with adaptation in hospital conditions. Especially for elderly people, this factor plays more important than others. Also, we should try to improve the patient's life quality and increase their life expectancy. It is the most maybe valuable purpose of this process, secondary prevention or dynamic observation. By other words, secondary prevention includes dynamic observation. So now we will analyze main tasks of dynamic observation for patients with chronic diseases. Among main tasks are examination and elimination the causes that contribute to the emergence and spread of disease. Next point is early active detection and treatment of early forms of disease. Next, prevention of relapses for peptic ulcer, for example. Prevention of exacerbation as for bronchial asthma and complication of existing diseases such as progression of MI. And development of chronic heart failure on this background. On this slide, you can see main stages, which we should perform for realization of dynamic observation for patients with chronic diseases. More optimal to start in each case, of course, in each separate case, to start this process from detection of early forms of diseases. Next step is diagnostics. Diagnostics, as you know, can include physical examination of patient, some laboratory tests or methods, and instrumental examination or investigations. The next step is carrying out preventive measures to prevent the disease development and changes in working and living conditions, which will help to maintain patients' health. Visiting patients at home, it's also very forbidden. And counseling of patients in various medical organizations. Now, please, let's discuss with you what's the role of dispensary observation, what is the process, and what GP provides in it. He provides information of lists or persons for dynamic observation. Also, GP provides in this process formation of lists of persons for dispensary observation. Of course, this list should include, or some lists should include different differentiation of all patients for some groups, if according to their diseases, such as separate groups. Patients with hypertension, patients, separate group for patients with diabetes mellitus, else one group for patients with bronchial asthma. And as we said before, this process should include teaching the skills of self-monitoring of health indicators. A new generation of adults, they are more predisposed for application of new technical devices without any problems. Teaching of patients about the skills of self-monitoring of blood pressure, glucose level. Patients with bronchial asthma, they should control their peak flowmetry. And according to plan composed by a general practitioner or specialists. Also, we should inform our patient, we should teach them for algorithms of their action in the case of the development of life-threatening conditions for their health due to their health problem. For example, self-correction, self-care for patients with acute coronary syndrome by oral taken tablets of short-acting nitrates. Activities. Which activities carried out by GP during dispensary observation? This procedure includes registration of patients in need of dispensary observation, informing citizens about the procedure, about the volume and frequency of recommended examinations. Organization and implementation of dispensary appointments, examinations, consultations, preventive, therapeutic, and rehabilitation measures. Sometimes patients can't come for a follow-up examination to polyclinic or to GP office. In case of impossibility of patients, possibility for the patients to come the follow-up examination due to the increased severity of impaired motor function, the organization of a dispensary appointment. Now let's start discuss so-called periodic examination or follow-up for the patients with chronic diseases. This procedure or action includes assessment of the patient's complaint and the patient's history of disease and physical examination. Then more attentive doctor will organize this process, then more then higher likelihood to detect chronic disease on early stage, and of course to organize early effective prevention for this person. Also, this process includes the identification and evaluation of laboratory and instrumental investigations. These investigations are this process includes also establishment of clarification diagnosis or pathological conditions after concrete examination. For example, after glucose tolerance test, we should confirm or exclude diabetes or coronary artery disease according to non-corrected level of total cholesterol. Obligatory procedure of these and which preventive obligatory procedure of this periodic examination is brief preventive counseling. Brief preventive counseling, as I said, it's final period of periodical examination patient. And in this time, this period, we should explain for our patients main risk for their health associated with their harmful habits, or for correction of healthy diet, for organization of healthy diet, for optimization of physical activity regime. I think all these topics and others will help to avoid or delay the disease development on as long as possible. Also, this procedure should include registration of patients and their families, their surnames in special cards, informing them about the procedure, volume and frequency of examination, organization and implementation of dispensary appointments, organization of specialist consultations, and also, of course, organization of necessary preventive, most effective therapeutic and non-infectious disease rehabilitation after non-infectious diseases. As for registration of patients that we have discussed, which other activities GP provides? GP during dispensary observation. In case of patient's impossibility to come for a follow-up examination due to disease or impaired disease severity or impaired motor functions, the medical organization or organization of a dispensary appointment or examination and or consultation at home. Now you can see the examples how to compose the program for dynamic observations. Main recommendation for these persons, patients with coronary heart disease. For example, coronary heart disease condition after MI more than 12 months ago, absence of angina or angina in the presence of first, second functional class stable angina, not more than chronic heart failure functional class 2. This person needs in consultation of cardiologist according to medical reasons. In case of chronic heart disease, stable angina, functional class 3, we should recommend periodic examination, of course, including laboratory tests, such as at least cholesterol level or some electrolytes, and obligatory consultations by cardiologists. And consultations of cardiologists for medical reasons. As for patients with arterial hypertension, for them, for all of these persons and their relatives, we should organize the screening for hypertension by a timely periodical measurement of BP level. In patients with newly diagnosed hypertension, perform analysis, urinalysis, creatinine, potassium, sodium, glucose, fast and lipid level, and an electrocardiogram. Also, we should suggest for this person who have compelling indications for pharmacotherapy, we should prescribe for them antihypertensive medication based on the compelling indication or indications. Now the time for break. My request for you, please again, send write to the chat information about how many students are present from your groups. Okay, now 10 minutes break, I'll declare. Let's continue our work. Thank you for your information about admission of our lecture in chat. And now let's specify main steps, which includes algorithm of secondary prevention for any diseases, any chronic diseases. So-called model of preventive visit of patients for the doctor, for his doctor, of general practitioner to general practitioner or to doctor of any specialty, such as cardiologist, pulmonologist, oncologist, and other. Step one of each visit is assessment of the new patient's complaints, assessment of recent anamnesis, and of course, providing a physical examination. Physical examination may be total or maybe general, or maybe concrete damage system, cardiovascular, respiratory tract, gastrointestinal tract. Step two, prescriptions, the necessary laboratory tests according to concrete indications, according to concrete disease. For example, for arterial hypertension, as we saw on the previous slide before break, it will creatinine test, uric acid, lipid profile parameters. Step three, prescription, the obligatory instrumental examinations and interpretation, of course. Realization and interpretation, their findings. And step four, correction of the diagnosis if necessary, for example. Elevation of functional class of heart failure or stable angina functional class, or elevation of stage for hypertension due to disease progression. According to corrected diagnosis, we should correct patient's treatment. We can prescribe more high doses. We can increase the therapeutical doses. We can recommend to combine any medications, antihypertensive or bronchodilators, bronchial COPD patient or bronchial asthma patient. We should organize brief preventive counseling for correction of patients' risk factors or trigger factors, and assess further tactics of his or her management, her health problem management. And of course, we should prescribe next. We should define the time for next visit for control examination. Let's again illustrate this algorithm by an example of hypertension, first stage. Regular preventive visits recommended at least 1 time per year, and which visits should control of blood pressure level and maintenance of this level of the target value, the collection of possible patients' complaints and anamnesis, presence, estimation of presence or absence of chest pain in the during physical exertion, If this pain present, we should estimate nature, characteristics, severity. Also, we should estimate urine characteristics. And we should clarify the fact and nature of antihypertensive drugs. If indicated, we should clarify receiving lipid-lowering antiplatelet drugs and hypoglycemic survey of behavioral risk factors. And also we should provide brief counseling with measurement of blood pressure at each visit. Also, during this visit, we should provide general inspection, physical examination of cardiovascular system, including palpation and auscultation, peripheral arteries, subclavian, carotid, renal, if possible, and femoral. Except it, we should measure calculate body mass index and waist circumference of hips at each patient's visit. As for step 2, laboratory survey. Plasma glucose, we should prescribe at least 1 time per year. Possible to use rapid or express method. Total cholesterol, examination at least 1 time per year. Also, which we can provide by expressed methods. Assessment of total cardiovascular risk according to SCORE scale. SCORE scale, it means systematic coronary risk evaluation or assessment of unfavorable cardiovascular events due to MI. Low density and high density lipoproteins, triglycerides, concentration in the serum not less than 1 time per year in 2 years for first stage of hypertension. Examination of serum potassium and sodium level not less than 1 time in 2 years. Serum creatinine level, same frequency, and urine test for detection of microalbuminuria not less than 1 time in 2 years. Instrumental examination. Step 3 of this process of this visit includes obligatory recommendation of 12-lead ACG examination with the calculation of Sokolov-Lyon and Cornell index at least 1 time a year. More informative echocardiography with the detection of left ventricle mass index for verification of hypertrophy and for assessment of diastolic function, not less than 1 time in 2 years, in the absence of achieving the target values of blood pressure and the presence of left ventricle hypertrophy progression. Also, this examination can include, we should prescribe measurement of pulse wave velocity examination in the carotid femoral arterial arterial not less than 1 time in 3 years without achieving target blood pressure. And so the fourth step of this visit, it's definition of tactics, further tactics of patient's management. Sometimes, if necessary, we should recommend therapy adjustment and explanation to the patient and or providing a reminder of its algorithm for urgent action at the life-threatening, such as possible hypertensive crisis. Possible hypertensive crisis. On next slides, you will see, I will explain, I will show for you examples of any standards for secondary prevention organization according to different diseases. For example, stable ischemic heart disease, I-1220, the National Classification of Diseases Code, minimal frequency of dispensary appointments, at least 2 times a year, twice per year. Obligatory examinations, monitored health indicators are arterial blood pressure, heart rate, and LDL cholesterol level. As for duration of patient dispensary observation, all further life, this person should be under doctor observation. Sometimes we can recommend examination and consultation of cardiologists for medical reasons. For persons with arterial hypertension from first to third degrees, with the exception of resistant arterial hypertension, at least 2 times per year. Also, arterial pressure, of course, we should measure control during control visits, and LDL cholesterol level, not more. According to standards is minimal, obligatory examinations. As for clinical guidelines, this document recommends more wide spectrum of examinations. And also you can see the duration of dispensary observation, recommended duration all further life with possible examination and consultation by cardiologists for medical reasons. Consequences of the suffered strokes for patients, at least also 2 times a year, with arterial blood pressure and LDL control. Again, all life, further life with examination and consultation, but neurologists, other specialists. For patients with stomach ulcer, same frequency, at least 2 times a year, no or less a relapse rate. No any monitor health indicators. Of course, we should recommend for them a fibrogastroscopy. And all their life, we should prescribe this observation with examination and possible consultation of a gastroenterologist once a year and oncologists on demand for medical reasons. For persons with chronic obstructive pulmonary diseases, 1 to 3 times a year. Absence, monitored health indicator, absence or decrease in the frequency of exacerbations. We will analyze spirometry parameters, blood oxygen saturation. All patients' life, it will organize with possible examination and consultations by pulmonologists for medical reasons. For patients with bronchial asthma, some differences with COPD. We should estimate achievement of complete or partial control of bronchial asthma symptoms. And also all life will observe them with examination and consultation by pulmonologists and sometimes with allergologists for medical reasons. For persons with diabetes mellitus type 2, more often. Frequency of examinations 4 to 6 times per year. We should control for them arterial blood pressure, LDL level, glycated hemoglobin, fasting plasma glucose, and glucose tolerance tests, all further life. For assessment of quality of this procedure, this process, secondary prevention of any chronic disease, we should know main criteria for evaluation, the effectiveness of dynamic observation for patients with chronic disease. Criteria of effectiveness. What these criteria are? There are a reduction in the incidence and days of patients' temporary disability. As I said, next lecture will devote to problem of disability, temporary and stable. A reduction in hospitalization cases, including hospitalization for urgent medical reasons, due to exacerbations and complications of diseases. Next criteria is the lack of an increase or decrease in the number of disability cases. Disability, or it means persistent disability due to disease progression, such as bronchial asthma progression, COPD progression, peptic ulcers. Other criteria are a decrease in the frequency of disease exacerbation, chronic disease exacerbation for 1 year. For example, exacerbations of bronchial asthma due to viral infections, or exacerbations of peptic ulcer due to like emotional stress or any other health problems. Reducing the number, we should estimate also, reducing the number of calls to the ambulance due to any chronic disease exacerbations, due to hypertensive crisis, due to bronchial asthma attack, and others. A reduction, and one maybe most important parameters, is a reduction in mortality parameters, including deaths outside health medical organizations. All these parameters we should analyze, for example, for preparing of any report for 1 year, for whole year, about main results of secondary prevention. Also some details or some parameters of dynamic observation. Sometimes we can recommend and we can confirm a cessation of dynamic observation due to some basis. These bases are recovery or achievement of stable compensation of any physiological functions after acute diseases. For example, after injuries, traumatic damages, poisoning, and others. For them, we can cancel dynamic observation. Next, base to achieve stable compensation of physiological functions or stable remission of chronic disease. Elimination or correction risk factors and reducing the risk of chronic non-communicable diseases and their complications to moderate or low. And this is already conclusion of our lecture. We should understand and remember that effective dynamic observation or follow-up of the patient is the most important condition for prolongation of the lifespan of patients with chronic diseases, and it's also condition for increasing their life's quality. It's very important and strategical purpose of healthcare system. So in your future practice, despite on your specialty, you will provide this dynamic observation or secondary prevention. It's not conclusion, excuse me, it's conclusion for full lecture, conclusion for first part. We should organize effective observation, dynamic observation for them. And the last part will, as I promised, will devote to patients' education as effective form of secondary prevention. Not so long, but what does it mean? Patients' education and which are the patients' teaching relevance. Patients' education is part of the whole arsenal of many chronic diseases treatment. Diseases such as hypertension, diabetes mellitus, heart failure, bronchial asthma, obesity, and others. Results of patients' treatment depends on patients' behavior very often. Of course, patients should follow the instruction, doctor's instruction, obtain the necessary knowledge and skills to make independent medical decisions, and they should be motivated. They should be motivated. Main purposes of patients' teaching are formation of skills of self-management of patients with regard to their chronic diseases, with orientation towards its transformation into an active participant in the treatment process. Preparation of the patient to the everyday use of new efficient technologies for the treatment of chronic diseases. As for main objectives of patients' teaching in patients with chronic non-communicable diseases, there are rising of patients informing about the disease and its risk factors, increasing the responsibility of patients to preserve their life. Formation of a rational and active attitude of the patient to the disease, and motivation for improvement, adherence to treatment, and the recommendations of his physician or their physician. Formation in patients and skills for self-health, providing first aid, self-care, first aid in cases of disease exacerbation and life-threatening conditions. Formation of skills of self-corrections, correction in patients with behavioral risk factors such as nutritional problems, of obesity, correction of physical activities, stress management, avoiding harmful habits such as smoking or drinking. Formation in patients, practical skills of drawing up an individual plan for daily improvement or weekly improvement at least. As for conditions of effective implementation of patients' education, we should develop a training program, educational program for them for chronic disease or specific forms. Should prepare methodological support and demonstration, tools, training. We have to prepare teaching staff, doctors and nurses. A convenient and simple explanation of maybe more difficult to understand parameters or terms. As for conditions for maintaining the relevance of the knowledge and skills of patients, a recommended frequency of patients' lessons 1 to 2 times a week if in outpatient conditions, or 3 to 5 times a week in daycare hospital. Recommended amount of patients in the group 10 to 12 people. A recommended multiplicity of rare education 2 times per year. And patient, you should be sure to keep a diary monitoring key functional parameters. As for factors affecting the efficiency of patients' education, there are trusting relationship between health professionals, medical workers, and patients. You should express understanding and empathy, ability to convince and explain any moments. Simplicity and accessibility of recommendations, and their realism for realization for individual patients. The availability of written instructions and reminders, patient's diary, the forms of methods of training, equipment of the room for the classes. As for criteria of patient education effectiveness, there are a significant decrease in the number of exacerbations of the disease, increasing the number of patients regularly monitored with functional indicators, keeping a diary of self-control, a reduction of new cases of temporary disability and hospitalization, improving the patient's life quality. And now already whole conclusion, final conclusion of this lecture, or second part of last part of lecture, education of patients with chronic disease in specially organized schools, successfully carried out at the outpatient conditions. It is effective technology for the secondary prevention of diseases and improving their life quality, their and their relatives. I hope that in your future medical practice you will organize these schools at least for your friends, for your relatives, or maybe for patients too. Later, according to a program of our course, I will read for you the lecture about, more detailed lecture about concrete, more detailed information about patients' education organization and patient school for concrete chronic non-infectious diseases such as arterial hypertension, bronchial asthma, chronic heart failure. Now our lecture is completed. If you have any questions for me, you can ask. If no any questions, then thank you for your attention. Be healthy. See you after two weeks later, 18th of March.
До свидания.
Good luck. Be healthy.
До
До
свидания.
свидания.
Bye.
Окей.